The United States is a big country consisting of over 3,000 rural and urban counties. It's so big, in fact, you may not even know how differently other Americans actually live. But when it comes to health care, there's one part of the country that faces some pretty unique challenges. For the average person, the term rural America may mean farmland and cattle. But almost 60 million people live in rural communities across the country. This population experiences significant health disparities due to a mix of issues, including a shrinking medical workforce and being far away from hospitals. Since 2005, 170 hospitals in rural communities have closed, and 700 are currently at risk for closure. COVID-19 has only exacerbated these issues because it takes priority. A new nationwide survey found 1/4 of rural U.S. households were unable to get medical care for serious problems during the pandemic. Rural Americans are more likely to die from the 5 leading causes of death, including heart disease and cancer, so this is a big deal. There are many factors that make this difficult to solve, but there's an urgent need in this major part of the country. My first guest is a small-town doctor who practices family medicine and gave us an inside glimpse at the hospital she works at in her hometown.
My name is Dr. Jennifer McKenney, and I am a family physician in my hometown of Fredonia, Kansas, a town of about 2,500 people. We have 1 grocery store, 1 pharmacy, a town square, and 1 school district. We also have 2 medical practices, one of which is mine, and 1 hospital. And although we have plenty of hospital beds, we have 0 ICU beds and only 2 ventilators. We can handle a lot here, but if a patient needs a higher level of care, it's our job to stabilize them and get them to the bigger cities. Our healthcare system has been doing a great job, but we still face a unique set of challenges that other areas may not face. The doctors and nurses and hospital staff that we have, they're the only ones we have. This is especially problematic with COVID because we need our whole team here ready for any outbreaks or to care for any patients that need us. So when you only have 5 doctors like we do, 1 being out sick is a really big deal. So we have to find ways to take care of our patients that might be a little bit different than in urban areas.
We're living in uncertain times. It's tough to keep up with the latest medical headlines.
About the market, panicked about COVID.
And how do those headlines impact you and your family? On season 13 of The Doctors, we want to empower you physically.
If I met them at dance, they would meet me at medicine.
Man, I love that. Emotionally.
If I can change my thoughts, I can change my feelings.
And medically.
He doesn't have his mask up, which is not a good thing.
This is the $1 million question, maybe the $1 trillion question. This is so critical for people to hear. We're giving you the inside track on health and wellness so that you can get back to the life you deserve. It's time to take back your power. The Doctors, now more than ever. Premieres September 21st.